Much information and misinformation coming at us every day. We're reminded of how much we still don't know about the mysterious coronavirus. So we want to take a step back and examine it all. What do we know now, and what critical questions remain unanswered? We'd like to bring in Dr. Simone Wiles, an infectious disease physician from South Shore Health in Massachusetts and an ABC News contributor. Thanks so much for joining us, Doctor.
Thank you for having me.
A new antibody study suggests that more than 20% of New York City residents have already been infected with coronavirus. Many had no symptoms and had no idea. So how does this information help researchers?
So it tells us that the infection has been around much longer than we anticipated. It seems as if, based on studies that were done earlier, that it might have been around since February in large cities such as New York, Philadelphia, and Boston. So it's been circulating in people who clearly didn't show any symptoms. They were asymptomatic. So it's been around for a while.
And those who've had COVID-19 or tested positive for the antibodies, are they now free to resume life as normal with total immunity from reinfection? And if so, does that immunity only last until this strain perhaps mutates?
So that's a lot of questions that we're still trying to sort out. It really is unknown. We do know that they have antibodies. The question is, how long is this antibody going to last? You know, in previous infections, we know that the antibodies can hang around for a long time. However, with COVID-19, there's still a lot of unknowns. And so I don't know if we can say the antibodies are going to last for a lifetime. I think that really is unknown. A lot of questions that we need to answer.
And for those who have recovered from COVID-19, what do we know about potential long-term impacts like neurological, kidney, or heart damage down the road?
You know, it has really been an interesting scenario for those of us on the front line like myself. Every day we learn something new about the COVID-19 infection. We're seeing a lot of cardiac issues, myocarditis. We're seeing blood clots. We're seeing neurological effects. I think we have a lot of studying to do to learn more about COVID-19. We really don't know what's going to happen later on to the patients who have survived COVID-19. A lot of unknowns.
A lot of unknowns, of course. And we've also heard of some rather unusual symptoms of COVID-19, like rashes on the toes, loss of smell, and also blood clots. Why do you think that those things are happening?
There is clearly some circulatory issues going on with your vascular system. So we are studying, why is it that these patients are getting these unusual symptoms, which we don't see in a lot of other viral infections. So definitely something that, as researchers, we're totally focusing our attention on that to see how we can better understand the disease.
And do you anticipate a second and potentially more deadly wave of this virus in the fall?
You know, I think in the fall, we're definitely anticipating to see more COVID-19. As to how deadly it is, I don't know for sure. But one thing I want to encourage everyone to do, continue to practice social distancing, stay home if you're ill, make sure you wash your hands all the time so that we all can be healthy and ready and prepared when it comes around in the fall.
Doctor, thank you so much. Really helpful information there.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.